Good morning, students. Today we are going to start temporomandibular joint, which is very important and from the physiotherapy point of view as well. So let's start with this. First of all, introduction. Joint between temporal bone, or we call it cranium bone, and mandible, facial bone, that allows the movement of the mandible for the speech and mastication. So mainly we are talking about the joint which is helping us in speech and mastication. So that is called temporomandibular joint. It is formed between cranium and facial bone. Major function is mastication and speech. It produces rotation and sliding type of the movement. Everybody knows about what is rotation and what is sliding. Okay, that is a normal, you can say that biomechanic component which is taking place in our body. So rotation and sliding are the part of the movement which we are going to discuss when we will discuss the kinematics of temporomandibular joint. It is also called as gangliomo-arthrodial joint. Structurally, it is condylar type of joint, act like class 3 liver. Okay, we have studied about the liver, so it acts as class number 3. So you can give an example of third order liver is temporomandibular joint. Now let's talk about palpation. How you will palpate? What you will do is ask the patient to lie down in a supine position. Place your middle finger over the like just above the patient ear and ask the patient to open the mouth. When patient will open the mouth, what you will see is there is a depression coming in. That depression is actually a fossa, which is called. We will discuss further what is the that mandibular fossa. So we are experiencing that. All right. So in this way, we can say that it is temporomandibular joint. So what we are doing when we are doing opening the movement, what is happening is your mandible is separating from the temporal bone. So you can see now, identify this bone, the greenish part, that is temporal bone. We will discuss in detail about this thing in detail, and you can see the lower bone, that is called mandible. Okay, we are going to discuss all these things in detail. So you can see now the main portion. Why I have included this particular slide is to show you that main portion is mandibular fossa, in which mandibular condyle is going to like make an articulation with temporomandibular joint. Okay, so it has further it has parts which we will discuss in this slide. So you can see that there is a squamous part, there is a zygomatic part. Okay, then there is a mastoid part, there is a mandibular fossa, there is a steroid process, very important function. Behind the mandibular fossa, we have external auditory meatus. So just see in this picture now for your more clarity. So you can see the squamous part. This is a lateral view. It is a squamous part. So you can see mandibular fossa. Okay, and then you can see the zygomatic process. There is the articular tubercle. Articular tubercle is having very important function because the disc is attached to it, which we are going to discuss with you further. What is articular disc? It plays a main role in temporomandibular joint. Okay, and then we have external auditory meatus, or you can say that part of ear. Okay, and then lastly we have mastoid process, and there is a styloid process as well, which is also playing an important part in the attachment of the ligaments. Okay, so just see over here in the mandible, these two parts are very important. So I have circled the first one, that is called sorry, it is a there is a confusion in this. It is a reverse in order. Actually, this part, which is a little bit broad, that is called condylar process, and the front one, that is called coronary process. There is a problem in labeling, so just read it as. And when I talk further in the further slide, it will be more clear in that picture. Just avoid this thing because it is labeled wrongly. I think I don't know how it is done. Okay, so you can see over here in this picture the front one is coronoid process, and the last one, which is head, we call is condylar part. Then we have neck, then we have ramus, then we have mandibular foramen, we have angle of mandible, there is a body. So all this is part of mandible. So now you have understood what is temporal bone, what is mandible bone. I hope you have understood this thing. Okay, let's go further now. Okay, so we have craniomandibular joint we are discussing about. You can see in that circle, that is the joint which we are mainly going to talk about. Okay, which is also called TMJ joint. It is a gangliomo-arthrodial joint. We call it gangliomo-arthrodial joint. It is a complex joint and compound in nature. It is complex as well as compound joint. So let's talk further. You can see that yellowish line which I have drawn. I have tried to explain you we are going to discuss about now articular disc, so that's why the yellow line is going to show you how the disc is being attached. So in the next picture it is going to be more clear to you. Okay, so you can see over here there is an articular disc. Okay, articular disc is the disc which is dividing the joint into two cavities. Okay, there will be the upper cavity and there will be the lower cavity, which I will show you. Over here, what I want to show you is how the disc is being attached. You can see that there is a posterior attachment of the disc, and then to the articular eminence it is attached further, and lateral trigoid muscle is also attached. Okay, so what is, as I have this picture will explain you how disc is dividing the joint into two cavities. So you can see that the blue lines, these blue lines are disc, and this is the upper cavity, and the lower one is called lower cavity. Okay, upper cavity, in upper cavity mainly translatory motions take place. What are translatory motions? Like protrusion, retrusion, they are translatory motions. They take place in upper cavity mainly. Whatever the rotation motion, they are taking place in the lower cavity. This is clear. Am I clear with you? This is going to help you when we are going to study kinematics. So that's why over here understanding how anatomy is contributing to that, it is important. Okay. Now let's talk about what are the articulating surfaces of temporomandibular joint. Okay, so we will say that over here, inferior surface of mandibular fossa. We have discussed about this is the mandibular fossa. So inferior surface is going to articulate as well as articular eminence. You can see over here, when you go down, you will see articular eminence. So articular eminence as well as inferior surface of mandibular fossa, they are the first point of contact. You can see that. And then another articulating surface is superior surface of articular disc. Superior surface of articular disc. So whatever the superior portion is, that is being in contact with the you can say that upper cavity also. Inferior surface of articular disc as well. Then we have superior surface of mandible. This is a very important question. In exams, this is normally asked like what are the articulating surface of temporomandibular joint. Then you need to mention these things over there and draw a good diagram and explain it. Now I'd like to show you how the things are anatomically, or how the looks originally. In the other sense, you can say that. So you can see over here in the middle, the D, which is labeled as D, this is articular disc. Clear? Okay. And you can see now this is forming two cavities, upper cavity and lower cavity, which we have discussed in the last slide. Okay. So I hope this is giving you completely the clear picture how it looks like. Okay. So you can see now disc is attached posteriorly and how disc is attached anteriorly to the eminence. Clear? So it is a unique joint covered by fibrocartilage rather than hyaline cartilage. This is the main thing. There is no hyaline cartilage. There is only fibrocartilage. Has four articulating surfaces. Two joints cannot be moved independently. movement is not guided by the shape of the bone, muscles and ligament, but also by the occlusion of teeth. So occlusion of teeth is very important. If the teeth are not occluding properly, then the movement is difficult. Condyle, glenoid fossa, articular eminence and trigoid tubercle. So that is being marked over here. Okay, anterior eminence which is present anteriorly. Okay, and then posterior tubercle which is present posteriorly. Clear? Just look into this picture now. Again, condyle is in contact with intermediate zone of articular disc. So now we are talking about the zones, particularly about the disc, how the disc looks like. So upper joint cavity is visible to you, everybody. Then we have lower joint cavity. Now you see the disc. In the disc we have intermediate zone, and then we have posterior disc bands. We have posterior attachments, which is directly attached to the auditory canal. You can say that, and then it is attached to the mandibular ramus as well. Okay, it has anterior band. Okay, so mainly you can say that there are three things in the disc. There is the anterior band, there is a posterior band, there is the intermediate zone. Okay, posterior band is further having an attachment, posterior attachment and a mandibular ramus attachment. Clear? So let's move further. In this picture it will be more clear to you. So this is how the disc is. Intermediate zone is there, anterior band is there, then we have posterior band which is divided into two parts. First, upper lamina of posterior band is connecting to the auditory canal, and the lower part is going to connect to the ramus. Okay, lower lamina. So that is, and further disc is also attached to lateral trigoid muscle. Okay, so now discuss this thing: articular surfaces, mandibular component. Let's talk about first of all mandibular component, condyle of mandible, and then articular eminence of temporal bone, articular fossa of temporal bone. Articular disc made up of the fibrocartilage, anterior band, intermediate, posterior band. We have discussed this thing. Posterior bilaminar zone, highly vascular and innervative. Now this is important. Posteriorly we have all blood supply. You can say that it is quite vascular in nature and innervated by nerves as well, which is going to give us the sense. Okay, so this is importance of, you can say that posterior band, posterior bilaminar zone is highly vascular. Anterior end is attached to the upper head of lateral trigoid muscle. Clear? So this is, so if somebody want to explain how the disc is attached, you need to draw the nice diagram as shown you in the previous slide, and you need to tell anterior end is attached to the upper head of lateral trigoid muscle, posterior end is attached to auditory canal and ramus, and there is an intermediate zone present as well, which is very thinnest portion of a disc. Now you can see, let's talk further. We have fibrous capsule over here, and we have lateral ligament, or temporomandibular ligament is also called. Then we have sphenomandibular ligament and stylomandibular ligament. Okay, when the ligament is attached from the sphinous bone to the mandible, we call it sphenomandibular ligament, and when ligament is attached from the styloid process and attaching to the mandibular, we call it stylomandibular ligaments. So this is clear. So these all are lateral ligament, and there is a fibrous capsule. So there are three things: lateral ligament, sphenomandibular ligament and stylomandibular ligament. So you can see over here I have rounded off what is sphenomandibular ligament. Okay, so then further there is a attachment of the muscles shown. There is the upper head of lateral trigoid muscle, lower head of lateral trigoid muscle, superficial head of medial trigoid muscle, and then deep head of medial trigoid muscle. So medial trigoid muscle has two heads, that is superficial and deep, and we have upper head of lateral trigoid and lower head of lateral trigoid muscles. So articular disc is present, capsule is present. So this is all about your anatomy. Okay, so let's talk about over here also the same picture which I'm showing to you. So I think for today it is more than enough. So we will discuss further in the next lecture. Thank you very much for listening.